Good afternoon, everybody. This is Janet Walker with the National Wraparound Initiative. I'd like to welcome you to our Wraparound webinar that we're having today. We're going to be starting with the content of the webinar in just a moment. A couple of housekeeping details before we get started. You've probably had a chance to look at the list up there. A couple things to highlight here that are relevant for listening during the webinar. If during the presentation you have a question, you can chat these to me using the question box, and we will perhaps deal with some of them during the content of the session, or perhaps hold them till the end depending on how the time seems to be evolving. You will not be able to talk until there's a question and answer period at the end, and if you have, there's a raising your hand button you can click on at your in your pane there, and we will unmute you and ask you to ask your question at that point. So with hopefully you've been able to read the other things, basic etiquette of being on a webinar. And so now we're going to move into the content today. This webinar is presented by the National Wraparound Initiative. I'd like to encourage all of you, if you're not familiar with the National Wraparound Initiative, to check out our website. You can Google it very easily, and you will see a schedule of future webinars and also information about becoming a member of the National Wraparound Initiative. The topic of today's webinar is the art of wraparound in the child welfare environment, and we are very lucky to have two very knowledgeable presenters today. We have Dr. Trish Nellius-Guthrie, who works with the Brevard Family Partnership. Trish is the founder of Systems of Care Consulting. She's also the CEO of Brevard Partnership, which is the lead child welfare agency in Brevard County, which is in Florida. She holds a doctorate in counseling and has devoted her more than 25-year career exclusively to child and family services, particularly in the area of system reform, privatization, and the implement of wraparound in systems of care. Helen Howe comes to us from California. She has a JD from Western State University College of Law in California, and also very experienced, 29 years of experience working in child welfare services, probation, and mental health. She is Orange County Social Service Agency Administrator for multi-agency family partnerships, including wraparound, multidimensional treatment foster care, multidisciplinary consultation team, and the Wraparound Provider Network Program. And I'm going to let them take it away. Thank you.
Good afternoon, everyone. Tricia and I, this is Helen Howe, and Tricia and I really wanted to welcome you and thank you. I'm very excited to have so many people on the call today. We're going to do a little review of our learning objectives, and knowing with so many people on the call, you may have different needs, but we are trying to kind of tailor it to looking at how we're creating the right environment and conditions for doing wraparound, and some strategies and a little bit of practice. So hopefully it will meet many of your needs or some of your needs. Our learning objectives today are to develop an understanding of the cultures that affect wraparound in the child welfare system, to review some key factors and strategies for communicating and collaborating with stakeholders, to review ways to develop clear roles, definitions, and some expectations for wraparound team members and your community partners. And we want to develop some strategies to create an inclusive, family-centered, youth-driven culture in a mandated service environment. Before we get started, we thought we would launch a little poll question to all of you out there so we kind of know who's on the call, and maybe that'll help us tailor a little bit during the presentation. So if you'll take a couple minutes to answer the poll, that would be great.
Hi, this is Janet Walker. Just want to remind you, we've already had a couple questions. The slides, we will be emailing you information about where you can link to just viewing the slides or to a recording of the webinar, including the slides. That information will come to you within 24 hours after the conclusion of the webinar.
All right, so here are the poll results.
it looks like we have a large number of you that are facilitators or supervisors. The next group, it's a pretty good, the remainder of you are kind of divided amongst the administrators, other providers, and things like that. Tricia, you want to go ahead and start?
Sure. Good afternoon, everybody. It's afternoon here in Florida, but I know it's various times across the country. My name is Trish Nellius, and I'm very pleased to be here today. One of the key questions that is constantly posed in the child welfare arena, and one that Helen and I have discussed at length and throughout the tenure of my career, is how do you achieve high-fidelity wraparound in a mandated service environment? And so we're going to discuss with you some strategies that really address how do you create the right culture, how do you ensure a consistency across the system, collaboration with system partners, and constant communication with key stakeholders. These 4 C's are really the essential ingredients to creating the environment and the culture for wraparound to be successful and to try to achieve as high fidelity as possible when you're in a mandated service environment. There are really 5 cultures that impact wraparound, and when you're working in a mandated service environment, it's very important that we understand how each one of these cultures influence and impact the quality and efficacy of wraparound as a practice. And those 5 cultures are the family culture, the professional culture, the system culture, the community culture, and the corporate culture. The family culture is really looking at traditions, norms, and values of the family, their linguistic needs, their cultural norms. And the professional culture, we really have to factor in, what approach, what orientation, what model do our providers tend to espouse to. Oftentimes providers, they see themselves as the experts and they don't necessarily see the family as the experts. So we need to factor in those considerations as we're trying to orient and create a system that's really conducive for wraparound principles to permeate. And then, of course, in our environment in child welfare, probation, any mandated environment, you have system mandates, you've got imposed timelines, you have certain infrastructures, and then even leadership changes, and how do those leadership changes within the judiciary or within our local community policymakers, leadership, how does that impact wraparound? These 5 cultures all influence what we do. The community culture, are you in a rural community? Are you in an urban community? Do the public officials really own and support wraparound as a practice? What are the availability of resources if we're really committed to informal supports and informal networking? What is the accessibility for our children and families? And then, of course, the corporate culture, because we have confidentiality issues, we have HIPAA, we have thresholds of authority, we have leadership issues, and all of these cultures impact the quality and the ability to do high fidelity wraparound.
Kind of following that, I want to talk a minute about confidentiality. And just so it doesn't make you crazy, Tricia and I will be kind of switching back and forth to hopefully give you a little variety during the presentation, but we'll be switching back and forth so you'll hear our voices back and forth. But confidentiality, as you're working with your partners, as you're working with your families, as you're working with all of the people, the systems that you're involved with, you're going to struggle with various different ways to be able to move forward and still maintain the required confidentiality and the privacy of the people that you're working with. So you want to create a safe environment, not only for moving forward with collaboration, but for receiving feedback. Whether it's your judges, whoever it is you're dealing with, and particularly with your families, always with the people that you're serving, you want to make sure you're creating an opportunity for them to provide feedback and information and suggestions and ideas that are non-judgmental. You want to be open to those ideas even when because we want to create this culture of looking at things differently. We want to be open to ideas of change and things that maybe at first don't sound like what we were thinking about from wraparound, but we want to be creative and out of the box. So you want to maintain confidentiality so you'll get some honest feedback, but you also want to follow through on doing something with the feedback and suggestions that you get. You don't want to just move ahead and ask for the feedback and not get reasonable modifications to your plan. that are going to include how you're going to use that feedback and improve your program and enhance your environment. And then the other struggle that you're going to have with confidentiality is the way to share system information, I think. And that's going to come up in a couple different ways. While you're working with families, in ways to share information, and then trying to track outcomes is going to be an issue if you're working with families that are moving back and forth through the system, whether it's child welfare and then they move and they're also a probation client or their mental health services client. We have, as Tricia said, there's HIPAA, there's all kinds of court confidentiality when kids are in the court system, and you have to find ways to be able to safely share that information, and maybe it's aggregate information that you need to share, but there also you want to be able to track outcomes. So you want to do specific tracking of kids to be able to share the outcomes of where you're going and how well you're doing and whether you need to change things. So trying to integrate those systems can sometimes be a challenge. But you need to, throughout all this, kind of think about that, because that is a field that you're going to have to navigate, is how we're going to deal with confidentiality through all of this.
The next slide is really looking at the wraparound principles, and most of you appear to have some exposure to wraparound and the practice of wraparound. So really when we talk about high fidelity wraparound, it really is to what degree do we adhere to these core principles and values, being family-centered, strength-based, needs-driven, highly individualized, community-oriented, team-driven, culturally competent, unconditional and persistent, outcome-driven, and inclusive of natural supports and resources. We're going to talk a little bit now about the system culture, because the system culture really does lay the framework and establish the framework for the degree of success that we can have when we're talking about really achieving high fidelity wraparound. So attaining the desired system culture is highly dependent upon how well supported wraparound is from the top down and the bottom up. Questions you might ask are, does the leadership at the top support the principles and values of wraparound? Do the policies that flow down reflect the principles and the values of the system of care? And to what degree do the principles of practice actually translate into policies that drive case practice? Having the philosophy and the principles that support the policies that translate into practice and partnerships are really the key framework for achieving high fidelity wraparound, especially in a child welfare environment. And then the next slide, if you can go to the next slide, and the next, thanks. We're looking at how wraparound requires a change in child welfare case practice, traditional child welfare case practice. And I've been involved in the field for over 25 years, and I've seen the evolution and transformation of the child welfare system. And we have sort of the traditional child welfare system, and we have sort of the new innovative child welfare system where we're really focusing on being family-centered and being strength-based. And it really requires a change in the values and principles that guide our practices, a change in our assumptions and biases about those that we serve, a change in the way systems are designed and collaborate in the interest of children, youth, and families, and a change in our approach and our case practice model. And then also a change in the way in which we deliver services. And wraparound has a history of positive change. Next slide. Thank you. Systemic changes in our community. I'll tell you a little bit about Brevard. We underwent privatization from being a state-run to a local managed system of care. And some of the systemic changes in our community was that we went from being state-driven to community-driven. And the community really got involved and established the priorities for our system of care. Some of the priorities that they required from us were that we implemented an aggressive front-end prevention and diversion program, that we had families and youth as partners in the process, that we had consumer involvement and consumer voice at all levels. We actually did an anti-stigma campaign called the Got Love campaign, because what we found was it was going to be really hard to engage families and have them open up and ask and seek assistance if in fact they were fearful we were going to take their children. So we really did a whole branding campaign And part of that whole branding campaign had to do with we titled it Got Love, and we called the program Brevard Cares, so that people in the community who were seeking assistance prior to reaching a threshold of abuse and when they were feeling the stressors that would result potentially in abuse would reach out to us. They wouldn't necessarily associate us as being the child welfare agency. We also implemented a centralized intake, a 24/7 mobile response, family-centered practice, wraparound, as we're discussing today, a continuum of care from entry to exit, and then also flexible funds to meet basic needs and flex supports. We unbundled and decategorized our services so that services would be tailored to meet the individual needs of families.
You know, Tricia, if I could just add in here, just to give you a little bit of the West Coast flavor of how we implemented Wraparound too, to parallel what Tricia is saying, is I think it really takes, it's not just suddenly one day implementing Wraparound. It takes a whole practice shift in a variety of different areas. And before we implemented Wraparound in Orange County, California, which we did in 2001, before that we had a whole series of that strength-based practices that we started to implement in a variety of different ways and start partnering with our courts and our community partners and introducing this. The reason why we wanted to do the practice shift, having people come out and present to the various different partners that we had and stakeholders, and sharing stories from other places about why we would want to do those things, from doing family team decision making. It wasn't just Wraparound. It was all of these other steps that led up to the start of Wraparound, and I think you have to do a lot of things to get there, to get people to buy into Wraparound.
And that's a really good point. When I first came to Florida, I met with a stakeholder group in the community called Together in Partnership. And when in Boston, when you attended a subcommittee meeting, you would expect 20 to 25 people. And when I walked into this first meeting, there were over 150 people. And they had been meeting for 3 years to analyze and dissect the child welfare system, the former child welfare system, and really do an analysis of need. And they were really invested in the whole system transformation, and it involved every leadership entity, families, foster parents, who really came together and examined the system. So that's a really good point. We had the courts, the schools, every stakeholder, the sheriff's office. Well, system change really requires consistency and cohesion, and there are a couple of our other C's. It really involves a system-wide understanding of the model and values, as Helen just said, and using and changing the semantics that we're well acquainted with in child welfare and mandated arenas. So use of semantics and reframing practices that support a strength-based versus a deficit-based approach. And that's just a really practical, hands-on, application that as we're trying to make that cultural shift, that we're constantly reframing those old ways of speaking about families and speaking about youth into a more positive and strength-based approach. It's also really important, as I've traveled around the country and met with a lot of communities that are doing system reform, one of the things that I have found that's sort of at the root of maybe some confusion and that lack of consistency is the community didn't really come together and define clearly what family inclusion model the system is going to espouse to. And these are 3 examples. They're not formal definitions, but examples of, is a system going to practice family-based care where families are invited guests at pre-scheduled meetings or standing meetings? Is the community really committed to family-centered care where families are partners in the process and they attend most, if not all the planning meetings? And then family-driven care where there's nothing about us without us. And it's very important that the system and that the environment in the system of care really clearly identifies with a particular family inclusion model. And that'll just lend towards the consistency. And then it's important to learn to function as a team versus unilaterally, especially in crisis. In child welfare arena, most of you all know that, every day is triaging. What is the crisis of the day? What is the priority of the day? And those children and families that are stable may oftentimes be put on the back burner because we're tending to the crisis, whether it be with the courts, whether it be with protective services or removals. But it's really important in the wraparound environment and to adhere to fidelity and try to increase fidelity, that we don't function only in crisis, and that we don't respond to families only in crisis, and particularly learn to function as a team. So it's having a really solid plan, it's making sure that the safety plan is in place, and that it's very clear and it's very concise and it's very usable. And then also using the wraparound process to reinforce its effectiveness in supervision, in team meetings, in staffings, and to address conflict. So no matter what venue you are in, whether it's with wraparound staff, whether it's within the community, we are constantly being consistent, and there's cohesion to the model and the practices, so that it's permeating through the system at all levels.
And I would just add to that, Tricia, is that is a constant issue, that distinction for your team and for your families of identifying what's a safety issue versus crisis. And your family team members that you have on there, your formal team members like your care coordinator, your facilitator, your parent partners, you really have to watch in supervision boundaries with them, and that they're not trying to rescue and get sucked into all the crises of the family, and looking at that safety plan and having the family learn how to distinguish between how they get resources for a crisis and when they need the assistance of the team, and what's a safety issue and when to follow the safety plan, so that we're not creating another situation where they're just dependent upon the wraparound team as another formal support. We really want to encourage them to develop those resources and to be able to manage that. Initially, you might do a lot more of those things when you're first engaging with the family, but hopefully over time, as you start to transition them, you're really encouraging that independence and that confidence in their being able to manage and deal with crisis.
And just on that note, it's really important that when you're having team meetings and you do have a good and solid safety plan, that because we are a triage environment and a crisis-oriented environment, that when families are doing well, we don't cancel their meetings. You know, there would be a tendency that when a family is stable, we want to cancel their meetings and tend to the crisis of the day, but it's really important, even if we have an abbreviated meeting, to get together, celebrate the success, impart hope to the family, and keep them stable, because then we're reinforcing the desired behavior that we are actually looking to achieve. When we reinforce getting a response and giving a response to families that are in crisis, we're actually reinforcing the behavior we want to eliminate. Some critical factors, and a quote from Woodrow Wilson is, if you really want to make enemies change something, and of course most of us have experienced that. We experience a lot of change in our system of care, even when we get it, you know, stable, and we're working with our stakeholders and our courts and our critical partners. Oftentimes we just get it finally stable and we have a change in leadership, and then we've got to start the whole process over again. But some critical factors are that cross-system staff really need to understand and appreciate each other's system mandates and priorities, and work together to achieve the common goals. And that's why it's so important to understand that we are all unique cultures, that there are 5 cultures and maybe more that really impact the fidelity to the model and to the practice. And so if we go in with our eyes wide open, that our mandates are required of us, and we all have to work within those confines, whether it be within an agency, whether it be within the system, be it the courts, whether it be within the county or the state responsibilities. If we have that appreciation for one another's mandates and priorities, we can work better to achieve common goals. The roles and responsibilities really need to be clearly defined, and when you have case managers and you have care coordinators, there's often that really blurred line of delineation, and we're going to elaborate a little bit more on that as we move on a little bit. And then also, public officials want to know what the system, that the system is efficient. They want to know it's cost effective, and it's really important that you keep this on the forefront of your communication with them. How do you get your message across to the critical players? Because remember, it's those principles that flow down to policies that impact practice, and it's often the public officials and the leadership that are developing those policies, and they're flowing down. So how do we have that support and consistency from the top down and bottom up? And then also use a cost-benefit approach as well as child and family outcomes approach. It's really important that when we tailor our message to the public officials, that it's a message that they want to hear and that they're interested in. The next slide really illustrates for you, and the next couple slides illustrate for you some ways that I have used data to inform our community of practice and our public officials and our legislators. I've presented this data to at legislative sessions, to the Senate Committee for Children and Family. I've presented it to the federal government when we've done our 4E waiver work. And really what this particular slide shows is that when we transitioned back in 2005, we had 1,450 children in care. And the pink top part of that slide actually illustrates the gradual reduction in the number of children in the legal system, the legal child welfare system, and the degree of increase since we started Wraparound. If you go to the next slide, you'll actually see where we started Wraparound with an investment in one care coordinator back in August of 2005, and I asked my board if they would allow me to invest funds that were slated towards prevention and diversion to hire a care coordinator to pilot the Wraparound project. And as we gradually increased, we achieved that destigmatizing of the system. We gained some credibility and confidence within the community that we could still keep children safe if they didn't enter the legal system. And you can see, as we've built the program and we've reinvested the dollars that were formerly on the judicial side of dependency to the prevention side of dependency, to date we've served 8,316 children now in our Wraparound program. And these are slides that I use when I speak to public officials because they want to hear about efficiencies, they want to hear about what's working, our effectiveness, and they certainly want to hear that we're keeping children safer and it's costing less money. The next slide actually just illustrates the cost of children in out-of-home care, in-home care, which is protective services, and then the children in Wraparound. So in essence, we're still serving 1,500 children here in Brevard County, but we're serving them differently because we've created a new level of care, whereas there was just voluntary services, protective services, and then shelter and out-of-home care. We've now implemented a very aggressive front-end prevention and diversion program, which is our Brevard Cares Wraparound program. And these are just examples of tools that you can use with your public officials and data that you can track that's important to them. And on the next slide, it also illustrates the cost savings, which of course is very important to our public officials. So you can see the number of children that we have diverted from entry into the system and the cost and the number of the days of service, how much money has been saved and reinvested in the prevention of child abuse since transition. And then the next two slides illustrate in just another way how you can convey that information to your public officials and to your legislators to keep and promote and support the practice of Wraparound. Next slide.
Okay, we really wanted to give you a couple different formats for outcome data, and the one thing I wanted to say is, these are numbers, specific numbers that work within the counties and states that we're familiar with, but based on whether you're a small county or a large county or how you're structured, these costs may be very different for you because your population numbers are different, the way that your foster care or your rate classifications related to group homes and behavior and how your funding works may really change dramatically about what that cost looks like for you. And you always want to think about, as Tricia said, who are your stakeholders and what information is important to them, because you want to find a way of not only effectively communicating that information to them, but in the format that they like. So maybe they like pie charts, or maybe they like graphs, or maybe they like little bullets or pamphlets. And you really kind of have to tailor it to that group, and you want to have a variety of different ways to format it to give it to that. And the way you present it to families is a whole nother thing about the way you get your information about Wraparound and buy-in and what they should expect from Wraparound. So here, this slide really kind of illustrates the way you can use some bulleted information. You could use percentages or actual numbers of the children in Wraparound services that at the time of closure have been able to be stabilized in their home. You could talk about, if you're tracking, and you might want to look at tracking, whether the kids have increased school attendance, and if so, what's that percentage rate, or what's that number of children for kids. And you might want to do it differently depending on how long you've been doing Wraparound. If you have a really small population initially, you want to put it in the most attractive way to support your outcomes, but at the same time you want to be accurate about that. So depending on what the population is, you might ought to change that differently. But whether they've moved from mainstream school, moved into a mainstream school, so that's another factor you could look at. You want to find out what kind of outcomes you want to track. Have they had decreased police contact? Have they had less in custody, whether it's in custody in the formal child welfare system or probation system? And you may not be able to track that, but if that's something that's important to the group that you're presenting to, you want to see how much of that you can capture for them to give them the outcomes that they're looking for, but you also want to be realistic about what you can actually track. You want to look at protective custody, hospitalizations, whether there's been a decrease in that during wraparound. You want to look at long-term outcomes, whether or not kids have been re-entered into the system in terms of child abuse reports or more maltreatment. All of those kinds of things can be data that you can formulate into an outcome. But you want to have a way to track it and have it be accurate and be able to have it in a format that's digestible to your audience. Next slide. Fiscal stakeholders, and you'll hear Trish and I talk about different people who are fiscal stakeholders, whether it's your board and you're a CEO and your board, or your executives, or your fiscal stakeholders at the state and federal level, your legislators, your court, or your local county board of supervisor, or even your own agency department fiscal people. You want to use the language and the strategies that are going to work with that communication. You want to make sure that whoever those fiscal stakeholders are, if they are accountable to someone else, that you're giving them the tools that they need and information that they need to help keep your wraparound practice alive and your message alive, and that you keep moving forward. So you want to make sure you're gathering the data that's needed, you're utilizing the support that is, you're utilizing supporting information, that you can demonstrate the economic efficiency of your program, that you can demonstrate your increased child safety, and then you want to make sure that you constantly are communicating and elaborating with them. You want to experiment with different formats, different methods of communication. Anticipate what they want to know when you're meeting with them and when you're going to follow up with them, and always be ever present. In the top of your mind should be any hot topics, any fiscal challenges that are going on, any political climate that may impact your program, your stakeholders, and resources that you have. Next slide. Some options that you might want to do is you might want to attend, if there's opportunity, for either legislative hearings or local county board meetings, or attending other types of briefings that occur or collaborations that occur that give you an opportunity to showcase what you're doing in wraparound and answer questions, particularly around budget time. And other times that are key political sensitive times where they're looking at legislative issues or they're looking at cutting funding. You want to be able to produce the information and get it before the people who are going to make a difference to being able to further what you're doing with wraparound. And you want to be flexible about needing to change what your population needs are as you move through wraparound. You may need to look at that from time to time and say, not only are we maintaining wraparound fidelity and here's what our outcomes are, but our population is shifting because of what we've been doing in terms of practice, and these are the things we're doing. Be aware of your budget limitations, and I said the political hot topics. Another format, if you look at the next slide, you can also use kind of a how many kids were in care. I think the way that Tricia showed it was you saw the graph of over time. You can do a very black and white comparison where you say, here's where we started. We had this many kids in care in our child welfare system, which would be dependents on this slide, or in wards that would be your probation kids. And then 10 years down the road, here's where we're at. So we've had this kind of dramatic 88% reduction in dependents and 70% reduction in wards. Sometimes that's a very effective way to help get buy-in, especially when you have new people coming on, when you're trying to bring your new stakeholders on, or somebody who's changed in your judicial branch. Maybe you have a new presiding judge, or you have new bench officers that are overseeing your child welfare cases, or you have new members of the board of supervisor, or you have new people that you're reporting to at the state level. You want to be able to share, in a real concise snapshot where you started and where you've come to, and how those are positive outcomes for the children and families that you're working with in the community. Next slide. I don't know if other people are experiencing, but I'm hearing some feedback in the line, and I don't know, Janet, if that's other people are hearing.
Yeah, I'm hearing it as well.
We've gotten a couple comments on it. It's intermittent. It seems, I don't know exactly what the problem is, so we're working on it.
Okay, I just want to make sure people could hear us. Okay.
Okay, strategies for shaping the system culture. It's really important that we anticipate that leadership changes will occur and that we proactively plan to orient and engage new leadership, to share data and outcomes and real-life stories with them. We've had experiences here where we've had turnover in a number of key leadership, and there can be some regression in the advancement or the stage or phase of your wraparound program if you do not anticipate in advance and proactively plan to orient and meet with. So for example, if there's a new dependency court judge, and with every new judge there is a new priorities and new focus, and they all have their own stylistic differences. So it's very important that your champion, your leadership, will go and meet with the judge, really orient them to the system, the values, the performance, the outcomes, and the real life stories that will make an impact and help them to garner and help you to garner their support and their interest in the system. And then it's important that you create an orientation program for all the newcomers to the system of care. In child welfare, we often experience a lot of turnover in staff. It can be a stressful environment, and it's very important that we, from the entry point of new staff, that we're really orienting them and not assuming, given that we've already gone through all of the things that Helen was describing with involving the community and garnering the community support, but we have to remember to really get those new staff early on and orient them to the system of care and do some shadowing and mentoring and intensive training with them. And then it's also important to meet frequently to establish a trusting relationship and to find win-win strategies to foster partnerships. So where can I give and provide support where I can garner support in return?
And I would add to that also, Tricia, that you want to use this orientation plan that you have also as an opportunity to re-energize the rest of your group and kind of check where you're at and the direction that you're going. You can use newsletters or participation in community forums to garner new partners out there in the community, but as well as to keep capturing and communicate as another way of communicating and updating your partners on what's going on, not just when they ask you, but even including them in celebrations. If you have family celebrations, if you do any kind of recognition of your family's successes within your child welfare agency, separate from wraparound, that's just part of your child welfare system, where you're acknowledging the successes of families and maybe even have families come and speak that have signed releases to do that, or that you have a panel of children or families describing what their experience has been. I think those shared stories and those opportunities to observe that firsthand are very valuable, and they have a very strong impact on the people that you're trying to communicate with.
They absolutely do, and particularly in the legislative forum and the legislative agenda, we will often go to our state capitol and take our children and our families with us to share their stories, because their stories are much more impactful than all the data that they hear from us quite frequently. So thanks, Helen. Okay, next slide. Okay, it's important that we collaborate with other counties and with your state child welfare services, and to develop a system for sharing support, data, training resources, much of what we've already shared, collaborating again on the practices and addressing the systemic challenges. In the state of Florida, we actually have 20 community-based care agencies, and we get together and we share best practices and we talk about what's working, and we unite when it's around a legislative agenda. And it's also important to incorporate wraparound into your strategic plan and to really have it be a living, breathing document that's meaningful. In our community, we have our strategic plan that is every month we review one of the key strategies and one of the goals so that we are staying on top of it, and it's not an activity that we did our strategic plan and put it on a shelf.
And I think that's also a way that you can really help your state and federal governing agencies. They have outcome measures that they're accountable for as well. And to the extent that you partner with them and work towards giving them the data that they need, and not only does that help you meet your accountability measures, but it certainly garners, I think, a long way the relationship that you have with them in terms of collaboration and showing how you're working also to meet the needs that they have to respond to, whether it's at the state level or the federal level.
Absolutely, and that's a really good point. A perfect example of that in the child welfare arena is our goal of placement stability. And we know that wraparounds, if you're doing high fidelity wraparound and have family teams and you have solid plans and safety plans, we know that it plays significantly and positively into placement stability, and that is, of course, a federal measure that our state is held accountable to. So that's a really important point as well. Next slide. So creating the culture. To establish a family-centered culture, it's important that we clearly articulate the expectations of case practice and clarify roles between the care coordinator and the case manager. And in wraparound facilitation really focuses on accessing community resources as well as the system resources. The care coordinator serves as the guide who oversees the team process and takes the lead on the cross-system collaboration, the pooled resources, the collective mandates, the family voice and choice, and in consensus building. And I know there's always a lot of questions about how do we clarify roles between the case manager and the care coordinator. The distinction between the WRAP facilitator and the case manager is really that the facilitator works with and guides the team process and the tasks while building collaboration with all parties at the table. And the case manager works with and follows and guides the service needs of the identified client. And that's on the next slide if you want to go to the next slide. It's one of the things that the easy way of kind of looking at it is in child welfare we know that there is the judicial case plan, and the case plan, I look at that as being your black and white and your all or nothing goals. So it's very clear, you know, around the long-term or the short-term goals for the family. The care plan is really looking at the incremental steps to helping the child and family achieve those short-term goals within that confine. So you're breaking it down when you're having a family team meeting and you're facilitating that process. You're looking at what will sustain the family over the long term versus, you know, the case plan, and breaking those goals down incrementally. And then the case manager really works with and follows and guides the service needs of the identified client. So one works with the family and the team, one works with the identified client where the client is currently served. Next slide.
And I would add to that, you know, the challenge that you're going to have is not only getting your case managers to not kind of step over their role when they're participating in a family team meeting and letting the facilitator or your care coordinator, whichever language that you use or label that you use for your facilitator, you want to make sure that they don't take over, because then the natural history and role and our traditional services is our case manager is kind of controlling and navigating everything, and it takes a little while, and they need to kind of experience wraparound and talk to their coworkers and their peers about the experiences they've had in wraparound so that they can see that it's okay to let go a little bit about that and really see the distinction between that court-ordered case plan, or if you're dealing with probation, the terms and conditions of probation, that's that formal, it's not flexible. The court has ordered it, the family has to deal with that, versus what the family has developed together and goals for their plan of care or their care plan to work towards a place that they want to be, that hopefully incorporates the safety issues that the court will have and some of those things that need to accomplish the court plan in order to meet their long-term goals that you have in your plan of care. But it's very difficult sometimes for case managers. It's not as difficult for your team because they're starting out that way. Your wraparound team has learned this to start with. But your case managers, I think, are the ones that have the hardest time being able to let go a little bit and sit back and be a member of the team. It's a wraparound team and not be the one that controls everything. So that's something you have to work with them. And I think they feel more confident as they experience wraparound and see the success and see the change and see how that different kind of practice and incorporating the family and setting and determining their goals it really makes a difference. I think the word of mouth and that experience goes a long way to having the case manager be able to move into that role. The other thing I was going to say was that you want to incorporate your wraparound activities in the court report. And that's just a suggestion. Not everybody's going to want to do this, but depending on how your court is set up, you may have a very adversarial. Some are much more adversarial than others. And what you might want to consider is whether having the wraparound team report on what's going on in wraparound to the court actually puts them in a more adversarial role. It may not. It just depends on your area. Out here in Orange County, what we do is we have the wraparound activities and what's going on with the wraparound team summarized in the actual judicial report that goes to court. It's just summarized as opposed, and then the case manager is doing that summary. And then the team really acts more to support the family during the court process rather than to be stuck in the role of having to be asked about recommendations and things like that, which are really the case manager's role. Their role really is to help support the family and move them towards their goals. So sometimes keeping your court from dragging your team in and making them foisted into a role that's not theirs or it's not their expertise to do, and keeping those roles clarified for your court and for the attorneys that are involved with all of our child welfare cases. And that, of course, varies too. Some have a variety of different attorneys that are involved in the child welfare process, and others have a more streamlined process. So I think those are things that you constantly have to struggle with, and those are challenges that you have to address and figure out what's the best way to present information about wraparound on these court cases. And you want to really distinguish the social worker's case management role from the wraparound team's supportive role. And it's also a very big challenge that you'll have is that sometimes your court will get so positive about the wraparound that they want to order every case into wraparound. And of course, we don't need every case in wraparound. Some families do work through our traditional services quite effectively, and they don't need wraparound, but other ones really do need a different approach. And so you don't want to, and you may not be able to support in your wraparound program every one of your child welfare kids in wraparound. So you have to kind of look at what are your resources, how many wraparound cases can you handle of your child welfare population, and you want to make sure that the court knows it's a voluntary one. It's not just another one of those cookie-cutter services, let's give every family wraparound, and we're going to order the family to participate in wraparound. So there's that constant going back to the court and making sure everyone knows that it's a voluntary process and why we're doing it differently with these families, and that it really needs to run that way in order for it to be effective and move forward. Next slide.
Now we're really looking at what are some tips to creating the culture, the desired culture that will set the framework for success with wraparound. The first I mentioned earlier is to really work at destigmatizing the system. Oftentimes the child welfare system has that stigma of we're there to take children away from their families, and that we're not as family-centered as what we are now moving and progressing towards as a field. And so destigmatizing the system and doing it in a very intentional manner is important. It's important to share success stories. As Helen was saying earlier, it's not only important to share it with public officials and with our stakeholders, but it's also really important amongst the caseworkers as they're investing so much energy on the front end, because a lot of times with wraparound, especially if you're a new system moving into wraparound and family-centered practice, there's a lot of work and a lot of coordination effort, and there's a sense from caseworkers of disempowerment, that they've lost their power because now rather than making unilateral decisions, they're making decisions that are vetted through teams. And so it's very important that they see the success and positive outcomes on the back end, and that's where the recidivism is going to decrease and the crisis is going to decrease. But oftentimes as you're making that a preliminary step in that shift, the caseworkers are stepping out into a territory that they have not experienced before, and they're putting trust in a system that they haven't yet experienced the outcomes. So sharing those success stories, getting those champions out there to share amongst their peers is very important. Having a consumer advisory council and training those council members to present publicly to legislators, to officials, and again within their own system, and to have voice and choice and to really help us shape our system so that it is family friendly consistently and providing us with the feedback that we need to strengthen our system. And also fostering strong partnerships between case managers, care coordinators, and the stakeholder community. We do a variety of activities within our local community where we bring everybody together. We have training venues. We have a variety of focus group venues, and we just get together to forge those partnerships and do a retrospective of our system and really look to how can we improve our system as a collective community of practice. And then it's important that you disseminate research and articles, and the NWI is a great resource for the professional development of staff and teams and even families becoming united with other families that have had successful outcomes in the system and now are becoming advocates and helping other families learn to navigate the system. And then also constantly conducting an analysis of needed capacity and capacity building plans. And the family voice is so important that if we don't have a required and necessary service for our families to be successful, that we're analyzing that and building that capacity through the reduction in costs, but by diverting children from residential stays and those more costly levels of care. And then develop a provider network credentialing and management system. It's really important in a system of care where you have a clear provider network that's a continuum of care from entry to exit. And then learning to reframe traditional child welfare terminology, as I mentioned earlier, into strengths-based and family-centered terminology. You have received, or on the NWI website, and you will receive via email and have already received a link to some materials that Helen and I have provided for you. And some of those materials that I have, one is strength-based assessment facts and the role of semantics, and it really helps to cultivate and practice how to make that shift in the way that we talk about, talk to, and engage our families. And then there's also a tool that I created. It's called the Access, Voice, and Ownership Test, and it's a good tool for communities to self-assess where they are in terms of their evolution in fidelity to the wraparound model. And then also the use of data and goals, as we shared earlier, and then communicating those successes and outcomes, also again as we shared earlier. And then it's important if you review a wraparound principle at every staff meeting and system-related venue, if you're constantly reinforcing for consistency the practice, the values of the practice for those that are new, and again to reinvigorate the system. Maybe devise a system transformation committee and engage partners when you're doing continuous quality improvement to really analyze your system. And make concerted efforts to minimize the mandates of the culture when you're interacting with families. It's very important that we promote voice and choice and our willingness to do whatever it takes. That is just a key element when you're in a mandated service environment. We have power over our families, and they know that we do. We have the power to remove their children. We have the power to terminate their rights if they're not doing well. But we can minimize that power to create a culture and a climate that's really conducive for partnerships, and it's very important that we minimize that. Also, looking at some common mistakes that happen in the child welfare arena when we're practicing wraparound and family-centered practice. One is using wraparound as a last resort rather than engaging families upon entry into the system. A lot of times, what I'll hear from communities is that they'll get referrals to wraparound when the family has burned all their bridges, when all else has failed. And if you're really adhering to the model, it's very important that we engage families at the front end using a strength and cultural discovery process, that we're building trust and that we're hearing their voice and involving them in the planning. And if they've already become alienated and staff are adversarial with them, then it's going to be very difficult to really adhere to the fidelity of the model. And so I encourage, if this does occur, and sometimes it occurs because the court will mandate it or it'll be required because of the systems that we're involved in, then it's important that you track those families differently if you're collecting track those families separately because poor outcomes associated with these families can also inadvertently be used for naysayers of the wraparound process to say the process doesn't work. So we want to be able to say, well, that family really didn't have high fidelity wraparound, or this particular population came in as a last resort, but that's not adhering to the fidelity of the model. And then other common mistakes in the child welfare arena is identifying services before we've identified needs. And if we have categorical service delivery systems, we'll often try to fit families into the services that we have available rather than be creative and customize the services to meet their unique needs. And then also family team members working in isolation and making unilateral decisions. That can be a real barrier and a common mistake. We really need to work as a team together and collectively. Also using traditional staffings and multidisciplinary teams in place of wraparound meetings and referring to them as wraparound meetings. Minimizing the degree of effort that's required on the front end. I had mentioned that earlier, so it's important that we get staff who've had positive outcomes with youth and family to champion that, because there is a lot of work in the coordination. And then also failure to educate and engage systems and community leaders that do have a direct impact on the ability to successfully implement wraparound, such as the guardian ad litem, the attorneys, the court system. And then there is some traditional child welfare versus family-centered practice history, and it's important, I think, that we look at that. And we're really talking about being child-centered versus being family-centered, and being deficit-based versus being strength-based, and punitive and compliance-driven, and rather than being real engaging, and focusing on the identified client rather than the family network. And then also short-term solutions versus the long-term sustainability, and mandated services versus the identified needs, and having those all-or-nothing goals versus incremental goals. So it's important that we create a blame-free environment, that we remember that plans fail, not people, because in child welfare, an average of 78 to 85% of children have a goal of reunification. So children are going to go home, and it improves their quality of life and the likelihood of remaining intact if we engage their families. And we're not, of course, talking about egregious cases of abuse. That we create a culture of inclusion and partnership between foster parents and biological parents. That can be an ongoing resource, a natural support for families if they build that relationship. And then setting and attaining incremental goals, celebrating success. It's very important, as I mentioned earlier, that we don't overlook the success for the crisis, because celebrating that success imparts hope to the family. And also convening family team meetings based on the acuity of need. It's important, especially early on, that if the family's in crisis, that we're meeting with them more frequently, and as they begin to stabilize, that we meet with them less frequently, because the goal really is for them to become more independent.
And I would add there, Tricia, that you want to practice for, as you start to transition and move to that phase of it, you want to start practicing and planning for when things don't go so well, when there's going to be a crisis, so that they've role-played that and they begin to build that confidence and they're ready for that. You start to back off, as Tricia said, from the number of family team meetings. You may go back and forth depending on the life of the wraparound case, how often you need those meetings. But as you're starting to move towards the end of achieving the goals that they set for themselves, and they're ready to transition out, then you want to make sure that you've let them have some practice with what could go wrong once we're gone. So you want to do that, and you also want to make sure, even in those situations where perhaps reunification doesn't work out with the parent, but wraparound's been involved and they've been involved, the family's been involved in developing the goals, I think it gives the family some empowerment to maintain some family connections and allow for some decisions to be made about the child and about the long-term plan for the child. Even if it doesn't result in reunification, you can also use wraparound to help make that relationship and those family connections be maintained, even if it doesn't end up being that that's who they end up living with, or when they age out of the system, that they still, we know a lot of our kids, even if they've had egregious cases, will go seek out their parents after they've left our system. So what can we do to try and make, foster those connections where they are healthy and build those relationships so that the impact of them striving for what they've lost isn't so horrible for them.
And then, of course, just illustrating that plans fail, not people, that it's unmet needs that cause a plan to fail or unidentified needs. And just circling back to incremental goals, I mentioned earlier that it's important when you're making the distinction between the case manager and the care coordinator that you have your long-term goals and your short-term goals. So if you, for example, in the case plan, it will be all or nothing, and it will say that a family needs to remain or a parent needs to remain drug-free. Period, end of discussion, and that they need to remain drug-free and be drug-screened weekly. So what we want to do in a wraparound plan is help them to remain drug-free for a week. And if the plan that we've devised to help them remain drug-free for a week is successful, we want to meet at the end of the week, we want to celebrate, we want to impart hope, and then meet again in 2 weeks and gradually, meet in less frequency as we're seeing the success. On the other hand, if the individual relapsed in the first week, we recognize that the plan failed. We need to identify the barriers, devise a new plan, and reconvene the team in a week. So the case plan goal will state again in all or nothing terms that the client has to remain drug-free and be randomly drug screened. But this is the long-term goal. So when you're working in the care team, you're going to devise a plan that's incremental and celebrate those successes so that the family will achieve those goals and be motivated to achieve those goals, and they won't fear retribution.
And I think along those lines, in addition to the family team meetings, you need to build in the process for emergency family team meetings so that when something like that happens, there's a relapse or there's something that destabilizes the environment in the home, that there's the ability to pull people together for that emergency to come up with a modification of the plans and goals to meet that need so that you can move forward until the next meeting.
Okay, next slide. And then strategy for success is the mandated environment. So convene family team meetings when the families are doing well and not only when there's a crisis. Identify barriers and challenges to the plan as part of the care planning process. You can have a great plan, but if you don't identify what are the barriers, the day of the week, the time of the week, whether they have transportation, child care, all of those things, the best plan can fail. And then ensure the plan is real time and that there are no unilateral decision makers apart from the court or apart from those that of course, have that level of authority. And then set measurable goals for the system. For example, do you want your system to strive to achieve 51% informal supports at the table? So communities should be striving to move towards fidelity to the model and setting those goals accordingly. And then also, better outcomes for children. What are the benefits of wraparound? Do you want to promulgate that message that children have better outcomes? There's less trauma to children when they're not removed from the home. The recidivism rates are improved. There are safer children upon reunification as families are less isolated and they learn to navigate the system. And they're more likely to seek help than if they were successfully engaged versus if they had an adversarial relationship with us.
Okay, we want to just kind of recap some of the things, just real quick recapping of some of the communication that you're going to need throughout wraparound is you're always going to want to know your audience. One of the tools that you'll see attached with either the link if you haven't already seen it or you will get it emailed at the end of this is you'll see samples of handbooks and information that are handed out to families because the way you communicate with that audience is very different. So you want to have it in a family friendly language, and you want to have it to be useful and simple that describes wraparound and also knows what they're supposed to do if wraparound doesn't appear to be happening the way they planned, what's the complaint process, how can they move about, what should they expect from wraparound, what about their privacies, anticipate questions that they may have, use common language for your audience, and then monitor the progress and the outcomes. So not just at the family team level, at the supervisory level, at the administrative level, and then, of course, at your fiscal stakeholders level and then your legislative level. You want to monitor all of that information and feed it back to the people who need it in the language and format that they need that. Next slide. I've included let's go back to where it says tools for feedback. Oh, there you go. Okay. I've included some suggestions for different tools that you can use. I think the more tools you use to get feedback and trying to monitor how you're doing, the better, because one tool doesn't meet all the needs that you have for all the different populations. One suggestion is a family satisfaction survey. You could do it where what you want to do in that situation is you want to give, again, as we talked about earlier in terms of confidentiality, you want that family to feel like they can say freely and speak freely in a safe environment about what their experience was at Wraparound. So what you might want to do is come up with some questions that you would do by a phone survey. You can do things like mail surveys with families. I personally find that when you try to do any type of mailed survey to families, you get a very low response. So the personal touch works a little bit better. And if you have somebody who's neutral, that's not from the provider that provided the wraparound, either somebody from the agency or a separate outside entity that does your satisfaction surveys so that the family can feel more protected and safe in that environment. You want to ask them some questions. Some kinds of questions you might ask is just real simple ones, because the families don't want to be caught into a long survey. So you want to make it easy for them to communicate the information, and you also want to have an opportunity for them to give this open feedback and comments. But things like during wraparound, I felt like I was, and then give some opportunities for answers, maybe some possible multiple choice selections. And as I said, it could be things like I'm overall satisfied with wraparound. I recommend the wraparound process to other families. Things like that, things that they would like to change, things that went well, didn't work, that did work for them. Wraparound helped me to get closer to my goal, yes or no. You know, things like that, just simple questions that they're going to be able to digest that are going to give you a snapshot of how that family felt about wraparound. And not all families are going to want to tell you that information, but you get a pretty good idea if you can get some of the families to give you the answers to those questions. You can do an online SurveyMonkey, but again, remembering who you're doing it to. They may not have access to computers. They may not be wanting to share information on there, but that's something that's available. A lot of people are using that, and some people are really enjoying using that medium to answer information, and they feel more anonymous in that process. Another thing you can do to look at the high fidelity of your wraparound program is one of the opportunities that are out there for you, and there's lots of tools out there, is the Wraparound Fidelity Index tool, and that comes out of Washington University. And I have the website if somebody wants to look at that tool more. Maybe we can send it out with the information tomorrow that goes out to you with the supplemental information. We can include some of the links to some of these tools. I just put them out there to you as a tool that's available to you. The nice thing about the Wraparound Fidelity Index is it is looking at its interviews, and they're measuring adherence and adherence to the model, and you're looking at not only the team, interviewing the team with a series of questions at certain intervals, including all the phases of wraparound and the 10 principles and all of those kinds of things. You're interviewing your care coordinator or your facilitator. If you have a parent partner, you're interviewing them, your youth partner, your caregiver, and even your youth, if your youth is in an age in which they could respond to that. So you're getting feedback from a couple different measures, which is very useful. And I think the thing that's nice about that is what you can do with that data then is you can kind of look at your scores about how you're doing in some of those areas. How are you doing at the various phases? How are you doing in addressing some of those principles? And are there gaps in your service where you want to look? Are we not creating enough natural support? Does the family identifying an area where we seem to have a gap so that you can kind of retool and look at your process and decide how you want to adjust it, if it needs adjusting, or is this just an isolated comment from a family, or do we see a trend or a pattern here that we need to adjust for? And that can really help you enhance your practice and fill in some of those gaps. So I think having a variety of different ways to gather feedback and use different tools, and you also then have to look at what kind of response do you get from your families and whether they like that particular tool, whether that works for you, and you may have to change that from time to time. Another thing that you'll see in the supplemental materials are roles and expectation checklist for your family team members. There's one for the supervisor, for the care coordinator, the parent partner, and the youth partner. And I think what you want to do in this situation is you want to make sure that you're all collaborating on what those goals and roles and expectations are. And then what we did in Orange County was you can use consultants. There's all kinds of consultants out there. We had Pat Miles come out with us and meet with all of our wraparound providers, and we sat down in a room together and really tried to work on shared roles and goals and expectations for each of those roles, so that our providers, if you have a bunch of providers or if you have one provider, you want to make sure there's cohesiveness amongst them and that they're all administering the high fidelity wraparound that you want. So you want to make sure they all see themselves in the same roles and that they have the same goals. So what we did was we developed those and we agreed upon them as a group, and then we came up with a self-checklist. So when you look at those, when you look at the handouts, and I know some of you may not be able to see them now, so I won't go into them too much, but it kind of gives a self-test where you go through by role, looking at certain core skills that you're supposed to have, some expectations, some universal job skills at various stages, whether it's engagement or planning, implementation and transition, and you're rating it on a numbered scale to try and see kind of how your staff are doing. You can not only use it for them individually, but you can also use it as a supervision tool. So there's lots of stuff out there. I encourage you to collaborate, though, on what those roles and expectations are, and then have some way, whether you use a self-check test or you have it through supervision, or there's people who use the team observation measure, the TOM, as you'll hear people refer to it, and a variety of other measures. You can use those in family team meetings to kind of check on how things are going. You want to have some kind of measure, though, that is routinely and at regular intervals is utilized so that you can get some feedback that way. And then what you want to do is, after you gather all this data, you just don't want to have a bunch of data that you sit there and don't do anything with. You really need to have an active way of evaluating and reviewing that data, and having your partners also from the outside look at some of that data, because you may not see some of the gaps that you have when you look at that data, but someone from the outside may. So you want to have other people look at those gaps and then look at what can we do to reach the goals. Are our goals realistic? Has our population changed? Do we need to be doing something different in our practice? Are we not reinforcing certain things that we need to be reinforcing? And really look at what can we do to enhance practice, maintain high fidelity wraparound so that our outcomes mean something. So that's just something, these are some tools, and I encourage you to kind of look at some of those samples and see if that's something that's useful for you, or we'll give you some various different websites in which you can follow up. We can give the Wraparound Fidelity Index tool website connection. I have Pat Miles, and then we also will talk a little bit about Wraparound Milwaukee when we get to talking about the provider network. Tricia mentioned it earlier, but when we get to some of the things that you can do to create those resources that you don't currently have in your formal systems that you find that families are really needing, and you might get some of that information out of these feedback tools. These are the things that the families felt were really helpful that don't exist, but we got it through Wraparound, or these are the things that don't exist in the community, but if we could develop that service, it would be really helpful. It would have made a big difference. You can use some of your Wraparound reinvestment money to kind of set up the structure and the services that you need. Next slide. Collaborating with court. We've talked a little bit about this, but I really want to emphasize what Tricia said earlier, is that you want to develop a system for communication. You want to use, not only do you want to educate and train and communicate and collaborate with your judicial officers or your board and all of those people at the initial time when they come on board, you want to have and create a way to have ongoing communication with them and use opportunities for educating and giving them feedback, and also them giving you feedback. You might have a case that comes up that brings everybody together for some reason that is an opportunity for feedback. Or there might be a celebration, as we said earlier, that's going on in the community that's opportunity for feedback. And I do think that you're really going to have to find ways so that your families and other people besides just the formal child welfare system is telling them the success of Wraparound, because I think it has a lot more weight to your partners when other people outside of the system in your community see that benefit as well. You want to detail the benefits and outcomes for your families, your attorneys in the court, invite them to any kind of opportunity for education. Remember, when you're dealing with different people, particularly with the court, their focus is on the law and the rights of individuals and child safety. They don't care about where you get the money to fund your program. They care about those things. So they may be a little bit interested in those fiscal ideas, but they don't want to hear the argument of we don't have money for that. So what you can do is talk about how the flexible funding works with Wraparound, and you can talk about how we can meet these individual needs of the families, and you can talk about child safety, and you can also talk about how the families have a voice in the process, which is going to be, may not be as big of a deal to the bench officer or the judicial officer that's overhearing it, but the attorneys that are in there representing the caregivers and the parents are going to care very much about that process, and you'll get buy-in from them, which may also translate into encouraging the court to be positive about that. So you can kind of use it both directions, from the top down and also from the bottom up. Be considerate of the time. If you're going to present to the court or trying to get buy-in from the court, you want to be considerate of the time constraints that the court is under in terms of their court calendar, their availability to meet for things. Unlike all of us in child welfare and some of the other communities, they are not as keen on all the meetings that we would do. They're very mindful of their time, and they just want you to get to the bottom line pretty quickly usually. So what you want to do is think about coordinating a brown bag lunch presentation for the bench officers. Come to them. You can invite them out to see the site where you do your services. You might invite them to meet a family. And what we talked about earlier, you can do a newsletter or pamphlet or some kind of report process, something simple that's very factual, because the court has a tendency to think you might get the perspective from your judicial officers that child welfare is very emotionally driven. It's not a science. So the more that you can give facts based on your experience and show them how the population statistics have changed and how they are now with Wraparound and the outcomes have changed for families, even specific families, I think that goes a long way to them seeing it as more evidence-based type of practice, as opposed to just, a touchy-feely kind of another social worker recommendation to do things a different way. Because I think you'll struggle with that from time to time with bench officers. Other ones are much more embracing of it from the very beginning. So it just depends on who your audience is. Be inclusive in the training opportunities. Celebrate successes with your partners, and include them in planning. If you reach a milestone, where you've served 3,000 cases or 8,000 cases, you want to make sure everybody knows about that. And it may not be a climate where you have funding to make some big community celebration, but you can do it in small ways that doesn't affect your fiscal outcomes very much, and you can do it in small ways and still share that success with, just like you do with a family. It doesn't have to be a big, expensive celebration. It can be small celebrations that are meaningful to that group that you share with the courts, with your stakeholders, and I think that's something you want to plan for and include in, just like you would include for a plan of care with a family. Reinvestment strategies, I want to talk a little bit about that. One thing that you'll see if you go onto the Wraparound Milwaukee website, they've done a very extensive provider network array of services to tailor to the families. And I think it goes back to that tracking and monitoring of the needs of your population. What are the services out there that they need that perhaps they can't access or a particular population can't access? And how can you develop a network and tools of resources to support the family's needs and goals? You want to do that. You can pull your Wraparound reinvestment dollars after you've been doing Wraparound for a while to help fund some of those things so that you can work from the front end forward. And that's what you want to do. You want to prevent kids from getting into those more serious situations, and you don't want to be working backwards. You can do things like, if you go on the Wraparound Milwaukee website, you'll see hundreds and hundreds of services that they have. On a smaller scale, you can do things like provide mentoring services or after-school services or crisis one-to-one services. Or perhaps if you're dealing with a particular issue in your population, if you have a number of sex offenders or sexual issues, you might come up with a service that relates to treatment behavior for them or tutoring services. There can be a variety of different types of services that you might use, but you want to tailor it to what is the gap that you have in resources and support in your area. You want to stretch those dollars as far as you can towards to enhancing prevention so that we don't have damaged families that we're trying to help recover from being in the system as well as from their abuse, that we're working towards hopefully keeping them stable in their homes and their communities before they ever get to the point where they need residential care or hospitalization or some of these more serious out-of-home care placements. The other thing you can do with your reinvestment dollars is you can look at what your referral criteria is for wraparound. As Tricia said, they really work from the prevention from the very beginning. You can expand that population to not just your kids that were at risk of in group home care or that you're stepping down from group home care. You can use the funds to leverage working with families that are in drug court where the kids are very young and they don't even have the behaviors yet, but we're trying to stabilize these families at the very beginning. Or perhaps maintaining kids that have large families and being able to keep them together in the home where they would have been placed out in the community in several different places, and maybe only two of those kids have behaviors, but the benefit of wraparound is that you can serve the whole family in that situation. And you might want to look at whether or not there are gaps in terms of your kids that are in residential care. How can you step them down from residential care? Some people may be doing AAP wraparound for our kids that have already exited out of the system and that are becoming destabilized after their adoptions. That's another way to help support kids and have positive outcomes. You want to also look at whether the kids that don't come into the system at all, perhaps in the voluntary way that they're referred to your child welfare system, that they get diverted to local resources. Is there a way that wraparound can support some of those families and maintaining them before they move forward and supporting them early on? So there's a variety of different ways you can use your reinvestment dollars to help continue to support families and have good outcomes and do it earlier and do that early intervention that you need. Okay, we're going to spend the last little part of it talking about some of the long-term benefits and sum up some of the successes, hopefully that you'll naturally see as you move along and wrap around. A couple of the benefits are success builds hope and empowerment for our families because they feel like they have been a part of the process and they've been a part of the plan to move forward to the vision that they hoped for. And they're not just being told some court-ordered, mandated service plan that as soon as the court's no longer involved, they can forget about it and move on and go back to the way they were. This allows them to have hope, empowerment, and actually work toward a goal that they've had a hand in developing and builds their confidence and their success rate. Partnering and inclusion cultivates trust and a willingness for families to participate. Better and more efficient use of community resources. If you use wraparound, you're going to have less of the duplication of services. You're going to be able to more effectively use the resources that you do have. Systems, some other system things are that families are going to learn how to navigate a complex system. Now, they're not going to do it perfectly, but they are going to learn. Some of them are going to become advocates. They're going to become your parent partners down the road. They're going to become people who know how to navigate the system better than some of our case managers, perhaps, because what happens is they start to build a unity of support. They start to receive from the team modeling and support about how to navigate. They build their confidence and their skill level. They learn how to navigate and know who to ask for what instead of wasting time going to the wrong people for what it is that they need. They know how to get what they want. And then I think what you have also is that you have to build into the long-term benefits. You have to do that practice that allows them to learn how to handle crisis on their own and know who to go to for support, not just the formal systems, but also those complex systems. Purchasing services are a short-term solution and can create an unnatural dependency while natural supports are available long-term. That's not only our formal supports that are the unnatural dependency, but you want to make sure that there's all these natural supports out there. And I think defining what a natural support is a key part that you need to do early on too, because some people will see some more formal supports as natural supports, but you really want to look at are they able to sustain without the child welfare system there, without the probation system, without some of those big systematic mandated services. So are there families, communities, church, educators? You want all of those involved in those kinds of supports, friends, anything that can be a support to this family so that they have a system to help them move forward in a crisis. Identifying strengths and supports to sustain long-term the family long-term beyond discharge. So we don't want families just to keep coming back to wraparound or back to the system over and over again. Just like in drug relapse, we may have some relapse for families occasionally, and that's okay. That's to be expected, particularly with some of the long-term behaviors and dysfunction that are in some of our families, but what you really want to do is move toward making them self-sufficient. So you want a reduction of, you want to be able to show overall that there's a reduction in the length of out-of-home care that you have for families, that the number of families in kids in placement is reduced, that there is a reduction in the spending and you have a better bang for your buck with better outcomes, that the services are tailored more to the unique needs of the family instead of a cookie-cutter approach, that you have less recidivism. You have less children that are coming back with child abuse reports or new maltreatment. They're not returning to the system, or they're doing so less frequently for longer periods of time of stability. So those, and ultimately your goal is for safer kids. Reduction, next slide. Reduction in delinquency and crime. And again, that's going to be something that's a little bit hard to track depending on how your systems interface, but that's certainly something you can partner with to get some aggregate data and find out whether there's a reduction there in delinquency and crime, or whether kids have been returning to the juvenile court system or back in custody or had more probation violations. And those kids sometimes are child welfare cases and probation cases at the same time, so there are opportunities to collect that data. Improve family functioning, improve academic performance. It's going to be hard to know the cognitive piece. Sometimes you want to leave that to the Department of Education and the school districts, but you could definitely look at, are they able to graduate? Did they graduate? Did they increase school attendance? That's a little bit difficult to gather unless you have a system in place to track that information, or you're able to collaborate with your Department of Education people to gather some of that data at the start and the end, because you want to look at behaviors, you want to look at academic performance, but you really have to have a measure of what was that like when they first entered Wraparound and what was it like, that same measure, at the time that they left. Are the families remaining intact? You want them to, because that's hopefully the long-term benefit. Children have support upon transition to adulthood. We don't have kids that have just turned 18 and exit the system and are out there on their own without any formal systems or not formal, any natural supports in place for them to be able to be productive members of society. So they don't return back into our system, either into the criminal justice system or as parents with children coming back where there's re-abuse and the cycle starts all over again. So we want to transition them with where they have an opportunity to create family connections and community support and natural support so that they exit the system successfully and stay out of the system. Minimize unnecessary placements and moves associated with the multiple. You're always going to have trauma if you have multiple placements. So the more you can stabilize, you get Wraparound involved more early on, you can stabilize those placements, and hopefully that child won't go to 4 different placements before they go back home, or maybe they can stay at home instead of go to those placements with the support of Wraparound. And I want to kind of take this opportunity, I think, now to answer some of your questions. We know there's been questions on there, and we kind of saved them towards the end. So we'll try to go through the questions here, and we'll do a little summary. So Janet, do we have questions?
Yeah, we do, and I just wanted to thank Helen and Trish for an excellent presentation, very informative. I do want to remind people of a couple things that will answer some of the questions that we've received. We had some questions about just some basic background and more information about Wraparound process, and evaluation, etc. I want to direct you to the website of the National Wraparound Initiative. It's www.NWI, like National Wraparound Initiative, .pdx, Peter, David, Xavier, pdx.edu. And in particular, under resources, there's something called the Resource Guide to Wraparound, which goes into quite a bit of detail about a lot of these different topics. If you're interested in the Wraparound Fidelity Index, which was mentioned there, there's some articles about the Wraparound Fidelity Index, and you can get to the website from the NWI website that will tell you all about fidelity measurement. That's there's a tab on the navigation about fidelity. So I'm going to pick off a couple of the quick questions here, and then some of the ones that have been, I combined a couple questions. So really quickly, these are: how many cases is it reasonable for a care coordinator to have on their caseload? And in the beginning, there was a citation of $184 per month compared to $2,500 per month for placement. The question is, what exactly is being provided for that $184 per month?
Okay, I can address that question. We have two sides of our wraparound process. We have wraparound independency, and we have high fidelity wraparound in our prevention program, which is Brevard Cares. One of the things that we are committed to is we have unbundled our services and decategorized them, and we have a wide menu, a menu of services available to families. There's probably about 60 or 80 services available to families because we've really tried to reinvest those dollars and build capacity. So whether you're on the prevention side or whether you're on the dependency side, our families have access to the same array of services. For $184, that's the average cost. Where you're getting the reduction in costs is the $2,500 covers the cost of case management, foster care or group care. It's an average rate. So if we have children in higher levels of care, then of course their daily rate's going to be much more expensive than children that are in lower levels of care, like traditional foster care. We also pay a child placing agency rate. So when we have foster homes, our foster homes are managed under child placing agencies. So you'll see on one of those slides it says $40 a day. That was the average that we utilized. That would be the lowest level of care plus the child placement rate, and then the average cost of services, and all that together comes to an average of $2,500 a month. The children in the prevention side really strive to have high fidelity wraparound, which involves a lot of natural and informal supports and community linkages. So while they have access to the same array of services, they're very skilled at utilizing the natural and informal supports.
Okay, thank you.
I was just
go
going
ahead.
to add that part of the question was what size caseload, I believe, that they suggested for care coordinators. And I will tell you, it kind of depends on how many kids and families you're serving. But it seems to me that between 8 and 10 is a reasonable amount of cases for a care coordinator, because you're going to have families coming in at different stages. The care coordinator is going to have new families and families that are in crisis, and there's going to be ebb and flow and kind of a roller coaster of engagement and re-engagement and retooling for the plan of care as they move along. So you don't want to have so many cases that when there is a family that is in need that they aren't able to be responsive to that. I agree completely with Tricia. You don't want to create a situation where you're only responding to crisis and ignoring families when there isn't a crisis. You want to have a balance there, but you need to be realistic about what the family is what the demands of the family is going to be on the care coordinator, and kind of average that out across your care coordinators so that there's a flow of not exceeding really about 10 cases, because it starts to be difficult to be responsive even on a regular basis, because you don't want to just abandon all the other families and deal with your crisis. You want to have a regular contact and have family team meetings and celebrate even when things are going well. So you don't want to have them so overloaded that they can't do both things.
And if I can just remark also, it also depends, I think, whether or not you have family partners and youth partners or you just have care coordinators. I think that's a big bearing on it. And you may not have the financial resources or the luxury to set your caseloads as low as what Helen is suggesting. And I think what you'll find as a ramification is you're not going to achieve as high level of fidelity. So we have family partners, youth partners, and care coordinators, and they work together in teams. But we have much higher caseloads than in our dependency side. And so in our dependency side, we do not achieve the level of fidelity that we would love to achieve, that we do achieve on the prevention side.
Yeah, and I think that's why you just have to look at what resources you have and whether you can fiscally afford to set them that way. I mean, you have to look at what you're trying to address, who your population is, and then you have to kind of, I think, adjust for it over time about what's working and what's not working so that you can maintain that high fidelity. That's just a struggle that you have to look at individually based on what your resources are and what your buy-in and support for things are.
Okay, here's another question. Who employs the facilitators? In our state, there are issues with the union. They are fighting the idea that service array should include facilitators to do this work with some families, as it would be threatening the job of child welfare workers.
Go ahead, Helen.
I was just going to say, I think it varies greatly. I don't think there's one way. I think it's done a million different ways. You have some are county-run programs. You have some that are privatized. You have some where even the county-run programs you're contracting out. So some of those union issues in terms, you really have to work, I think, even with your union people if that becomes an issue, because what you're doing is going back to that role clarification. It's not intended for the RAP team to take over for the case manager. It's not intended to be a competition. It's supposed to be a support of that process to meet the outcomes of the family. It's not meant to be one or the other.
And I can just remark that in our system, because our care coordinators, we're a lead child welfare agency and we subcontract out case management. We don't deliver case management. So our care coordinators serve as the utilization management staff, and so they are staff of the lead agency and they work in collaboration with the case management agency.
And I think that's frequently the case, is that you have the child welfare agency, the case manager continues to be a part of the team. They're not taking over that role, but it certainly varies greatly across the nation and certainly outside of the United States as well. It could be done a variety of different ways, and then I think you just have to look at what's the best way to alleviate the fears of your people who are concerned about those. How do you address those issues? How do you partner together to make it successful? Because what we want to do is we're not sitting here trying to find a job for all of us. We're trying to find outcomes for families, and you know, they're hopefully along the way we will see less families involved in that back end part of the child welfare mandated service process, and they'll move towards the front end, and that's good for everyone. So sometimes making everyone see that doesn't mean that you still don't have opportunities to work with families. You just do it in a different way.
Okay, I have a couple of follow-ups to the cost question. So I think people are really very interested in this question. So here's a follow-up. Are you saying that $184 a month covers the cost of care coordinator, family partner, and youth partner? That's about $6 a day, correct? And then we had another question related to cost that said, how can you afford to keep 8 to 10 families on the caseload when, at least in the case of the questioner, they were paying up to about $60 an hour for care coordination.
Okay, the question for me was, how do we afford, how can you reframe that again, Janet?
Yeah, okay, so the figure cited again was $184 a month.
Correct.
And this person is saying, are you saying that that covers a care coordinator, family partner, and youth partner all on $6 a day average?
No, that is the average cost. Our children, those children only stay in care 167 days. So what we did was we broke up over 12 months the cost per day of the services that the child and family receive, and that is not inclusive of the staff.
Yeah, I think you have to look at the different ways you're packaging how you get your cost, because you need to look at the length of the time that the wraparound team is involved with it. If you're contracting with people, you may contract with, you may do some type of request for proposal based on a public bid process, and then you set amounts that you're going to contract with people for, so you control the cost that way. And it includes in there the operating expenses and the salaries and staff, as well as what it's going to cost to have a flexible pool of funds available to meet the family's needs. And you may have to fine-tune that over time, but it really just depends on, it also depends on how many team members you have and what your expenses are going into it. There's just so many different factors. You can do it a variety of different ways, and it's hard for, I think, Tricia or I to speak to a generalized way you would do it everywhere, because it's too different. We can only kind of give you our experience of things that we deal with and tell you those are some ways that you can do that.
And if you compare, if you look at the chart where there's out-of-home care, in-home care, and wraparound, you're going from one extreme to the other. So the out-of-home care is $2,500 a month. They are children that are sheltered or in some higher level of care. The children that are in protective services and at home and also receive wraparound, that costs $400 per month on an average. So we could have children that cost us, $600 a month and children that cost us, $20 a month. But on an average, it's $400 a month. So you've got the continuum of $184 for the children receiving wraparound, $400 for the families receiving protective services, and then, of course, your $2,500 for those that are in the judicial system that are receiving, that are in out-of-home care or in placement and usually have more intense needs.
And the other thing I would say, too, is it really depends on where you are, what your rate classification levels are. In California, for some of our high-end group home residential care eligible kids, that Wraparound can pull down funds on. As recently as this past year, there was a lawsuit that made that rate up to $1,000, per kid. So when you're talking about working with that kind of money, it really affords you a lot more. If you use it for even a few kids, if you pull down that amount for even a few kids, if you're able to pull it together, you're able to spread that cost out to so many other kids, and if they don't stay in the system as long and you are using it for a smaller population over time, then the cost saving is just tremendous to the county and to the state. So I think you just really have to kind of look at what your numbers are and how you capitalize on showcasing the change that happens once you do wraparound.
And I think the key element is, and I can actually send these graphs and charts with more specific information to anyone who's interested, and I know Janet's going to give that information afterwards. But I think the key is that in the CARES program, there is a very strong emphasis on community linkages, and our community is really rich with resources. So we're not necessarily contracting for the service array. Child care is supplemented. There's a lot of things in the community that are supplemented, and so we may not be putting out the funds to pay for the services, and we don't pay we don't say every child gets $300 or
Right.
$400 or $2,500. We don't budget that way. We simply have every care coordinator has a 1/12 allocation that they get to work on, and then they use those funds for their family and have to stay within that allocation. And that really inspires them to be very creative with natural and informal supports.
And we do a similar thing in regards to that, as we do contract with private providers that bid for the contracts, but in that includes their cost for all their salary and their staff and for doing the things that we ask them to do, but it also includes an amount of flexible funds per agency that they can expend on those kids. And then, keeping with the model of wraparound, there's going to be some families that it's not like a $300 per kid kind of thing. There's going to be some families that need a couple $1,000s a month, and there are going to be other families that don't need hardly any as you're transitioning them, depending on where they are in wraparound, depending on what resources are available to meet that family's needs. It just really gives you that flexibility to tailor the money and the resources to those families that need it, and just give the support that's needed for other families, so that you really do see the cost benefit long term, and you really will see a reduction if things are done properly and you get the outcomes for your family.
Okay, I'm gonna ask a couple people here on the phone who have raised their hands. So we have a question from Daniel Thompson. I'm going to give you 5 seconds to answer me back here. Daniel, are you out there? Sometimes people get inattentive out there. Okay. I've got Alice Brown. Maybe people are...
As we get to the end, we're probably losing a few people now.
Well, these people are still shown as being on. I'm not sure exactly what's doing. Okay, I have one more question, and then maybe it'll be time. Well, here we got Nancy Garcia. I wonder if our audio's working right. We still show 165 people. So let me ask one more of the questions off the list, which is of interest to me. Foster families often feel that they have it together and don't value or see the need for wraparound, and feel that the wraparound is kind of more aligned with the bio parents, or the foster family doesn't support reunification. Are there any tips for dealing with those kind of situations?
Sure, I can. Oh, go ahead, Helen.
Oh, I was just going to say, the one thing I would suggest is you want to include, if that's a challenge that you're having, and we all have those challenges, whether it's with wraparound or some other kind of service as you're working through the mandated environment, you want to include feedback and input from your foster family community. You want to work very directly with those foster parents that if you're going to have a wraparound case involving that the foster parent's going to be involved in, you want to see if there's a way to incorporate them in the team, get their ideas, get them on board. It's the same. You can use the same kind of thoughts about working with the foster family as you do with the bio family, but what you want to watch is that your case manager is also being very clear with your foster parent about what the goals, whether you're in reunification. I think that clarification of where we are moving through the system and what's going to happen, the more that they're a part of knowing what the plan is from the mandated service side and the court side, as well as incorporated in being able to be a part of working towards a safety plan and being a part of the goal and having some role in participating in that, I think it helps to overcome that.
Alrighty, I'm going to try one more person off the phone here. We have Georgia Baker. Hello? I can hear you. Georgia Baker, question? I guess not. Okay. Well, I think that's a good cue to finish up with. Let me say that any other, let's see, I heard at least one other resource. I think it was Trish was going to give maybe some more information about those cost calculations. We will post them also on the page with the supplemental materials. And we will post information about how to get in contact with the presenters. That'll either come out on the email, or I think that's probably the best thing. We'll send it out on the follow-up email. So any last observations from our presenters?
Yeah,
Well,
go ahead.
Go ahead, Helen. I was just going to mention the conference, so I'll do it when you're done.
Okay, I just was going to say, you know, in the short time frame, there's always some great opportunities for networking and collaborating, and trying to meet everyone's needs is always a challenge. But we're hoping that as you listen to the presentation today, we did achieve some of our goals, and that we were able to give you some tips and some strategies that you'll be able to take back and are useful. And we certainly welcome contact if you want further clarification. I really want to thank you for participating and your intention, and I really wanted to leave you with a quote. Both Tricia and I both really enjoy the Mahatma Gandhi quote about if you really want to see a systems change, what you really want, and what Gandhi said was, be the change you want to see in the world. So Wraparound is an opportunity for all of us to be the change that we want to see in the world, for us to have safer kids and families and more positive outcomes for our children and families in our communities. So I'll leave that back with Tricia.
Thank you. And I just want to really reiterate what Helen has said. It's a great charge to implement Wraparound the child welfare arena, and I'm really privileged to have an opportunity to share what we've learned through our growing pains and years of developing a community of practice. And I think there's a strong network and a really growing tide and interest in, you know, practice and practice standards for implementing high-fidelity wraparound the child welfare arena, and you all, I know, have learned a lot and have a lot to share. On that note, I wanted to just announce that on February 16th to the 18th, we will be hosting the Changing Tides Innovations in Wraparound Conference in Cocoa Beach, Florida. The cost is $425, but it's $385 if you are an NWI member. There's a discount for members. There are only 30 slots left if you are interested. We have Janet and Eric are going to be joining us. Eric Bruns is going to be speaking. We have John Franz who's going to be present, John Vandenberg, Dr. Munoz, and a whole list of people that you can go to our website and reference. We would love to have you. We have a special emphasis and interest in developing the field of practice, particularly as it relates to mandated environments and child welfare. So we look forward to seeing you there, and I really appreciate your being on the call and giving me this opportunity.
Well, thanks again to our presenters, and if you want an easy way to get to the information about the conference, it's also posted with all the links on the National Wraparound Initiative website, which is up there on the last slide. And just to remind you once again, you will be getting an email with information about how to access the supplemental materials. If you go to the NWI website that's up there and click under webinars, the recording of this webinar plus a PDF of all the PowerPoints will be posted there. That's where it's going to be. So you can check there, and you can also check for future webinars. Maybe you will find some other topic of interest to you. So again, thanks to everyone. We had a very active audience today with lots of questions, and thanks again to our presenters.